Good morning. No, that's all right. So this is Dr. Rutledge, and we're having a talk today, and we will do this so your identity we will not give out.
Yeah, okay.
Sometimes we think, well, maybe we should get you to give your bank account number on YouTube, and
No problem.
probably not a good idea. No.
But there's nothing in that.
So, all right, so good. So what we're going to talk about right now is we have plenty of time.
Yeah.
No rush. We're very flattered that you're here, and maybe I will do what I just said. If I have your permission,
Yeah.
I will do a little introduction again.
Okay, right.
So we're going to talk about a couple of things. I'd like to talk about obesity.
Yeah, right.
In other words, many people think they understand obesity. You are obese, you're obese, we are obese because you lack willpower.
Yeah.
That a good strong man, a good Sikh, would not be obese because if he noticed he was gaining weight, his strength of character.
Yeah.
Guru Gobind Singh would say, yes,
Yes.
you have the strength of willpower,
Yeah.
but here we are, we eat too much, and so I want to talk about where obesity comes from, if I have your permission.
Yes, sir. Okay.
Because I think there is some important knowledge for all of us.
Yeah.
I'd like to talk about the treatments.
Yeah.
What are the treatments for being overweight? And tell you the latest scientific data as far as I know. What could we do if you're overweight? Tell you that there are many surgeons, many patients, many doctors around the world who think an operation is worth doing for being overweight. And we will talk about the different flavors. Good honorable doctors like the lap band, and good honorable doctors like the sleeve, and good honorable doctors like something called the Roux-en-Y, and now a lot of good honorable doctors like the Mini-Gastric bypass. So, if it's all right, we'll talk about these a little bit, depending on your wishes.
Yeah.
We'll talk about the benefits. We think of the Mini-Gastric bypass, but not just the benefits, we'll talk about risk.
Yeah.
Okay, now I don't want to talk about risk. I'd like to turn off the tape and forget and say nothing about risk.
Yeah.
There is risk. This is life. The other day we were driving back from Chandigarh, and there was a young girl who was hit on the road. So there's a risk driving here,
Yeah.
especially driving
Especially driving here.
here. But this is not to laugh about, but we must talk seriously to let you know what are the risks, what are the good and bad. There are some really good things about the MGB because like all surgeries there's risk, but the risks are pretty low. And some of the risks are things that we can undo and fix. So we'd like, if I have your permission, talk about these things.
Yes, sir.
And if we have to take a break, if you get tired and we need to, walk around or something like that, let me know.
Yeah.
Anything at all is fine. But those are some of the topics that I'd like to go over.
Yeah.
If it's okay, then you will also be thinking of things, and you might say, I want to go obesity here, here, here. You might say, You have a question to interrupt and ask something else. This is fine.
Okay.
Finally, it shouldn't be last, maybe it should be first. I'd like to talk about Kular and Kular Hospital.
Yeah.
Okay, now, I keep saying all these good things, but his team, his hospital here, he has people come from all over the world. He has results, as I said before, that are equal to or better than anywhere in the world. We talked about risk. One of the most terrible risks that scares me about the surgery is that when you're sewing inside, you could think of us as being like plumbers. We hook up tubes and things like that.
Yeah. Right.
And if you're doing plumbing, you could have a leakage.
Yeah.
Okay? Inside of you, leakage is life and death.
Yeah.
Okay? Kular's results with leakage are better than, one of the best hospitals in the world is the hospital. And their results of having leaks is almost, in some studies, up to 1 or 2 out of every 100. And Kular's is 1 or 2 out of every 1,000. So almost 10 times better than that great hospital in the U.S. And we think it's not necessarily because those surgeons are bad, but we think MGB is pretty good.
Yeah.
But overall results of this surgery are good, and we'll talk a little bit about that.
Yeah.
So I have your permission, does this sound like okay?
Yeah.
And if you get tired, because many people tell me I can talk the ears off a brass monkey.
That's a lot of talk.
That's a lot of talk, yeah. So, okay, so let's start. Can I talk about obesity?
Yes, please.
So obesity is simple. You eat too much, I eat too much,
Yeah.
and if that's all there is, it's easy to fix obesity.
Yeah.
Eat less. So, may I ask, you've tried to eat less?
Yeah, I have tried to eat less and quite difficult to control. I can eat less for a few days, a few weeks, but I cannot continue more than that because the desires stops me for continuing that thing.
Right. You and I would say, okay, say I have this belly is growing on me.
Yeah,
I say to myself, I want to get back in my old pants.
yeah,
I will lose weight, and it works until lunchtime.
yeah.
And then from lunchtime, it works till dinner time, and then
It starts again.
chicken,
Yeah,
and here I am now Sikh, so always 1 or 2 pegs.
yeah.
Yes, a little whiskey must go, and then I'm a little. If you are a little bit heavy, why did you not just eat less? Have you tried to eat less?
I did. I'm trying to like just have a healthy breakfast or eat healthier if not eat less.
Yeah.
But there is so much temptation.
Yeah, yeah. And then people say, well, just exercise, okay? So, why don't we all just go run? He has a big, have you seen the big space back here before?
Yeah.
We should let's run. Let's just run and run until we get there. So why don't these things work? I want to give you an example of something, okay?
Yeah.
First of all, I want to tell you that you know that your country and my country and other countries were not always heavy. This is brand new in the 20th century.
Yeah.
So how could this happen? Okay, it could be that all of our countries became weak. We became lazy. We became bad. But it happened quickly. So I would like to say that we think that the new U.S. diet is poisoning the system. It damages the normal process that tells us you've eaten too much and stop. So if you give animals lots of sugar in their diet, lots of fat in their diet, the little mice, the little rabbits, and the humans get big, and even then you give them a healthy diet, they don't get thin again because the damage has
Already been done.
happened. So let me give you an example. You have a nice car in Canada?
Yeah.
Okay, all right. Let's say, for the purpose of this, you have a nice, shiny black new Mercedes.
Yeah.
Top of the line car, yes?
Okay.
And it is parked, you drove it here across the ocean, and it's parked outside.
Okay.
That's in your mind? And you see me, I pick up a big sledgehammer.
Yeah.
And you say, Dr. Rutledge, what is with the sledgehammer? I said, come, we're going to your car, I want to teach you something. And I take it and smash the lights in the front. And smash the hood and smash the front glass. And you say, okay, I've learned the lesson, stop. If you tell me to stop smashing the car,
Yeah.
will the car heal? Once you have damaged it, if I put sugar in the gas tank and the engine seizes,
Yeah.
will the car get better on its own?
Never, never.
Okay, so we think, this is a little complicated, we think obesity comes from our bad diet, and somehow inside of us, our engine, which has kept us healthy for thousands of years, and thin, and all of a sudden, all the sugar and all the fat, all these other companies, Coca-Cola, candy, all these things, just like Rutledge smashing the front hood headlights on your Mercedes, doesn't get better when you say, I will eat healthy now. But all of those years prior to that with the bad foods damages the engine.
Yeah.
And the only way we know this moment, to fix the car is to go to the shop. And so we think that a diet for you, according to the scientific research, a diet for me is unlikely to make you healthy.
Yeah.
We don't wish this answer, but right now we have no pill that will make the glass grow back on the Mercedes, that will smooth out the paint on the Mercedes and give the glass back to the Mercedes. The Mercedes has been damaged by salt, sugar, fat, and that has left all of us a little damaged.
Yeah.
Not everyone, but in some of us, we have the genes so that when you put sugar in my gas tank,
Yeah.
okay, and it doesn't get fixed by just going on a diet.
Yeah.
I wish I had a pill. I say, thank you for coming. Here is Rutledge pill,
Yeah.
right? And you're better. We don't think that happens, just like I can't give you a pill for your Mercedes.
Yeah.
Does this sound reasonable? So, what can we do? We take the car to the shop. What we mean by that analogy is, we know that surgery seems to help change you or fix the Mercedes.
Yeah, you're right.
Okay? So now let's talk about the different surgery choices.
Yeah.
You can take your car to the Ford store, the Mercedes store, wherever to be fixed. So, a good choice, people say, look, you try to eat, I will grab a hold of you inside with a plastic, solid band, as tough as steel.
Yeah.
You try to eat, you cannot eat. It's a very simple and safe surgery. My opinion is that the research shows it does not work too well. Why would it not work too well? Let me explain. If you have a tight grip on your esophagus,
Yeah.
if you eat a piece of broccoli, you feel sick.
Right.
Okay? If you eat a big bite of sandwich, you feel sick. So many people with the band do very well for a while, for maybe several years, because they try to eat healthy and have trouble and fight and struggle. But after a while, that desire to eat begins to tell them that broccoli will just hurt me. So what could they eat or drink that will go through this? Coca-Cola,
Yeah.
ice cream, candy. Because it has to let fluid through or you could not live.
Yeah.
So these patients begin to fail, according to the research, and according to my opinion, at 3 to 5 years when they can't stop. They begin to drink these liquids. Okay? So that if you use this technique of grabbing a hold of inside of you as a fix, we think that's not so good.
Here I would like to add something
Yes.
with your permission.
Yeah.
In the year 2006, I was in India and I got a chance to get operated in Apollo Hospital,
Yes, yes.
Hyderabad, and they suggested me, because obesity, okay, let implant inside the gastric band.
That's what we're talking about. Yeah.
And that time the gastric band was coming from Sweden,
Yes.
and they brought a Sweden gastric band and they implanted it into me. And okay, they have tightened the band and they told me all that thing, and it was kept on esophagus and small pouch was created. It was okay, it was good for a couple of months for losing weight. I lost up to 30 kilos and after that I started the erosion on my esophagus, and getting in the night itself the food was coming out,
Yes.
like have a very strong heartburn.
Yes.
And then I got a habit to eat the diluted foods, which are having a lot of calories in the form of sweets, in the form, I dilute, I'll chew more time than I do, because it is hold only 100 grams of the food.
But you are telling me my story.
Yeah, so that was-
Everything you say, is this not right?
and that was removed again. They suggested me in Canada, this is a lot of problem is coming in your esophagus. So a lot of erosion is there is a chances of further damage.
Yes.
So they removed the band.
Yes.
And as soon as they removed the band, again I have increased up to 40 kg more
Right.
in 6 months.
So here's another trick, which is if you... So here's another sad part. If you go on a diet or if you go on the band or something and it fails, you've actually taught your body to live less, so you actually gain more. So, but everything you said was exactly what I said. In other words, lap band,
Yeah.
it sounds so good and simple. The surgery was simple.
Very simple surgery.
This is-
And I was told like that nothing you can reduce. And after that, even if you want to eat something, going to doctor, this time fill it little less.
Yes.
So you make friendship with the doctor, and doctor also kind this man. Then he will take out the more fluid from the where they used to keep inside the fluid, the decrease in inflating. So that was the thing, and I felt very, very sad because I believed in that theory.
Right, and maybe sometimes the doctor will see the patient who's the band is doing badly, and they will go, band is good, bad person, because you are not good. They will say, not that the surgery is bad, but the patient is bad. And so what I would like to say is, my opinion, there are good doctors who like the band still, not in India anymore, but in the US they're still, so they are not bad doctors, but my opinion is that the band does not work well. And your experience matches.
No, because you are not able to reach up to your prescribed goal for weight loss. Because there are different cultures in the world, and in Canada, whatever, when some function is there, someone is getting graduation and wanted, do you eat less, you eat little bit more, they will poke you to go little more. So situations also make like that in parties, and you cannot sit alone in the corner or say, I will drink only 1 cup of soup and I'll go away. So,
but even if you tried though, remember that inside of us are reflexes. Okay, what is a reflex? A reflex means if I suddenly clap my hands, my eyes must close. It built into us, into our body by God. We cannot help because that's a reflex. And the reflex inside of us to eat is as powerful as anything that is in a human. So the band does not affect the reflex. It says, I must eat, and you ate your reflex was so powerful that you would put food in there, some healthy food, and it would begin to dilate and swell and damage the esophagus. Okay? So your experience, exactly my opinion. Not everyone would agree with the two of us, but your life experience exactly what I
I had a very, very, very nightmare experience, and I remember that days it was reflexing in the night, all the bitter food coming out, and I was in the sleeping condition. I never thought the reflex will come during my sleep, and it comes through the nose also, and it was very difficult for me to clean the nose and all that because these things are happening.
See, we want you to be on the videotape telling everyone the opinion of the band. Because I mean, if I say I'm not a big advocate of the band, people will say, well, that's because you are the father of MGB. So a father must say good things about his children, always, right? But you have said this, and you have no reason to say against the band if it was good.
The band is only good for the people. Those are very, very target is maybe 20 kg, 30 kg losing maybe. But
even the data for them is bad after 5 years.
If they are still not able to change their lifestyle, that is also waste.
And the idea of changing lifestyle is hoping the Mercedes will fix itself.
You are.
I don't think that changing lifestyle doesn't fix any science. There's no science that works.
And once the damage happens to your esophagus, it's damage for forever. Once you go for a big hammer and just put a shot, you cannot repair as same as it is.
Exactly.
So it is really good, not good.
So we talked about now the lap band. Now I want to talk about the other new surgeries called the sleeve. Okay? And I say, my opinion, the sleeve is the lap band again. Instead of one piece of plastic, they cut all your stomach away and sew it up, so now it's as tight and narrow as a tiny tube.
Small tube, like a banana.
The same size as the intestine, probably less.
And not only that, instead of having the band, at the bottom of all of our stomachs is a muscle called the esophagus, which is like the band. So the patients who have the sleeve now, in my opinion, have exactly the same experience you're having. So we looked at Kular's data from this hospital. Okay? And when sleeve came out, Kular is an open-minded man. He said, for example, for our young, healthy, unmarried women, maybe to do the sleeve is a little better. We will try it for those women instead of MGB. And we had several hundred of his patients who had, 5 years ago, had sleeve. And in fact, the first couple of years, the sleeve is good with weight loss. But then, kind of like your band, the weight comes up, reflux, acid, burning, and the weight comes back. Because again, they cannot eat sandwich. They cannot eat
Piece of broccoli.
broccoli, yeah, exactly. what happens to them is they say, I know what I can eat, and my reflex, which drives me to breathe. In other words, think of your breathing. If I say to you, you are an intelligent man, stop your breathing. You could be the smartest, most powerful willpower. If I say stop your breathing, we laugh. If I say to you, okay, you have sleep, now stop your eating, it still does not make a difference unless you fix the reflex. Okay? So sleeve, in my opinion, is like the band. But one more terrible, in my opinion, just terrible part of sleeve is that when you're suturing and doing it, the studies reported from around the world say 1, 2, 3, even 4 people out of every 100 has a leak. Okay? And if things inside of you leak, maybe you have to stay in the hospital 3 months.
More dangerous.
Maybe even you do not survive.
Yeah.
And so sleeve is simple, but again, I'm writing a paper. I was over in Kular's house writing a paper right now, looking at all the recent publications from this year. There are many publications saying that 1, 2, 3 out of 100 sleeves will have a leak. In Punjab,
Yeah.
there are several surgeons who are not surgeons anymore because of leaks. So, Kular, 2 leaks out of 1,000. Sleeve, 2 or 3 leaks out of every 100. Kular does maybe 30 or 40 MGBs a month. If he had a leak, 3 leaks out of every 100, he would have leaks. He would have a whole floor full of leaks.
Yeah, you're right.
And the family's all here. We could not practice. It would be no. So, again, that's only my opinion, but there's good scientific published research that sleeve, although many people think it's good, may fail, like the band with regaining your weight, may fail with the reflux and acid, and, in my opinion, there's many published papers saying leak. Okay, so we are not much in favor of band or sleeve. We have one more to go through, which is called the Roux-en-Y bypass.
Yeah, before this, I would like to say something about the sleeve surgery. During the search of reducing the weight, I got a chance to meet 2 doctors in United States. I would like to take the names because now they are not so. So one doctor is Dr. Shrikant from Seattle Hospital, Washington. And one doctor is very renowned doctor in the world. You can find on the Discovery Channel also and TLC channel also. His name is Dr. Now, Jordan. So I met him personally. So few months, maybe 1 year back in last year February, I met him. I got a chance, and he told me, gentleman, I would like to do sleeve on you. Then I said, sleeve is having a lot of problems because today the internet is wide area. You can find anything on internet and you can learn and you can share your ideas with the people in the different forms. So he suggested me, and you are surprised to know that to that kind of a doctor I searched for 1 year before I speak to you, and to say no to him I took 1 year to update my knowledge and to come about to know what is the sleeve and what is the bend and what is other surgeries. So during that, I even though I know that today because of that research, I gained the weight also 25, 30 kilos. But if I have taken a right step that time onwards, and I met you or Dr. Badgley that time in Florida, by the time, or one of your colleagues there in Missouri.
Yeah, Dr. Hargoder.
Dr. Hargoder, I spoken to him personally.
He's a good man.
He's a good man. And he suggested me that time, okay, Manohar, better you come over here because you qualify for surgery, your BMI and everything is okay. But I after knowing, and then I met Shrikant in Washington, Seattle, and that doctor said, I don't take any responsibility for leaks or anything. It is your luck. I say, why are you saying luck? When you're charging money, you should give at least some guarantee or some knowledge. He said, no, this is sometimes it's happened. Yeah. I said, no, it is not like that. So I meant to say that to getting education about in Mini-Gastric or sleeve or other surgery, I took 1 year. And I would request to my all friends, whoever come across the surgery, they should meet the proper surgeon and should check his all the research and publications. then only we should understand what is. Otherwise, simply they say it's very easy, very good result. First, you have a honeymoon period in 6 months, you lose 90 to 200 pounds.
Yes.
But that are not correct.
No.
Because they don't know what are the vitamin deficiencies is going to come. Because they are totally cutting out your stomach and throwing it out from the body.
Yes, I do not like that part.
Yeah.
We will talk about this. You know, we were slightly critical of your lap band,
Yeah.
but you know what was good about it? They could get rid of it.
Yeah.
If you have sleeve, there's no way out. You know, you can't come back and say, I want the stomach back. MGB, like the band, I think has a good feature, which is we can undo it. But
See, what I want to say, every human being on the earth don't want to go for any surgery. It is perfect. Unless they really realize it or need it.
yes,
But at the same time, every individual also, human being also want that it should be reversible.
absolutely.
So
If I walk in a building, I want to be able to walk
Yeah.
out.
So, if I am entering into a place, where should be an exit also?
Exactly.
So-
or like when you go to a theater in the
Yeah.
movies, they have the red exit.
Right exit.
Yeah.
Exit.
Yeah, yeah.
So, and further, there are some access are also there which called the emergency access.
Yes, I want the exit.
So, yeah, the
Yeah.
exit. So, these kind of things I won't find. I have done a lot of studies in this area and I found that no, there is no exits are there.
Not for sleep.
Yeah, not for
Sleep is-
sleep.
And that's a good point. So for example, let me give you some exits, some of my patients. So the surgery MGB is very powerful, very powerful. It's in fact, almost 1 out of 100 patients will get too thin. In other words, we can talk about how powerful to make your surgery for each of you, and we can adjust it. And so some people say, look, I do not want to be a fashion model, I just want to be healthier. So we can turn the power of MGB down.
Yeah.
But then other people say, look, I want to be thin. And so we can turn up the power. But as we change that power, there's some risk you could be too thin. So
Yeah.
in my 6,000 patients, we have about 100 patients who got too thin. Now, it turns out that the nice thing about MGB, like the band, which was a good feature, not the band is not all bad,
Yeah.
but one of the good features, in my opinion, of the band and the MGB is it takes about 30 minutes to revise and undo the MGB. If, God forbid, the terrible tragedy that in a year or two you were to get too thin.
Yeah.
And many people, when I say that, they kind of laugh at me, oh, I could never be too thin. But MGB is so powerful, it can make you too thin.
Now, I would like to thank you especially, Dr. Rutledge. You made a very good system in your process for selecting a candidate for the right surgery or the right person or right candidate. You have a system that please have the emails or talk to at least my 9 patients. And I would like to tell you that I done very honestly that one. And we have gone into Yahoo gastric patients groups. And I simply sent an email. I got a lot of emails. And one lady, Barb, was there from New York. She got operated from you, I think, 8 or 10 years before. Me and my wife spoken to her for 30 minutes over phone to the New York. And she was so kind of you. And she explained and she told me, Manohar, if you want to give the best gift in your life, that is your MGB, you are giving best gift in your life to yourself. It was that Barb lady. I can show the emails I have with me. And at the same time, I got a chance to talk to other 2 ladies. And that 2 ladies also very kind of you. They had done one of from surgery from you, one of Dr. Pelgari from Florida. They are very like your staff and all that. And really, the right surgery told they haven't, they are losing the weight and still they are maintaining that weight. That is the kind thing, and they never have any problems.
Yeah.
Even
and
though
think of this for 10 years.
10 years. And I would like to say that regarding cost also, people say yes, it is worthy to spend the money on this surgery. Even though they don't have any funds from insurance. I know insurance companies are sometimes rejecting the surgeries and in Canada or in the States. And the most important thing is I have shown one video to my daughter and she is agreed to go for surgery.
But before she can decide, she has much more we're talking about today. But
Yeah.
that is, think of this in my opinion. In other words, you have good honorable doctors. In other words, I am not a better person than the other surgeons you've met. But we say, look, good honorable men say this choice is better. One says lap band, one says sleeve, one says MGB. So how can you decide? Well, what we say is we'll do our very best to tell you everything we know, and that we know that people have been choosing me and this surgery for 16 years. And if you listen, we have people 10, 12, and my wife, Trish,
Yeah.
15 years from her MGB.
Yeah, she also got it.
Yeah, so it doesn't make everything the right answer, but we try and do everything we can to let you know everything we know. And we certainly say our opinion is that if you look at the published research, the MGB is the safest,
Yes.
the lowest leak, the lowest of having someone not survive, of dying,
Yeah.
the happiest patients because they can eat. They do not have this. And so maybe this is a time to say, how does MGB work? How does
Yeah.
MGB work? So Kular has told me a beautiful way to maybe explain it to his Indian patients. Before surgery, when he asks his patients, when they eat dinner, how many chapatis?
Yeah.
Maybe 4 chapatis for dinner before.
Full of what they
After MGB, 2 chapatis. Okay. So this is good. And do they have, you know the feeling, you ask father, ask the feeling of the lap band. 2 chapatis into lap band?
Yeah. Vomiting, reflex.
we were there, we saw it.
Okay, so, but if you talk to MGB patients, 1, 1.5, 2 chapatis, not fast. In other words,
Slowly.
if you try it fast, you will feel like the band, but
Yeah.
if you have a bite,
Wait for something.
then you can have a nice dinner, a satisfying dinner. When you talk to my patients, they say,
Yeah, I talk to them.
they say, look, yes, I have it. But they say, if you ask the plate that they ate for dinner before surgery, say that is 100%. After surgery, they tell me on average, they eat 1/4, 25%. So the amount they eat goes down, but not because of this,
Yeah.
but because actually they tell me, and we have measured it, they are less hungry. That the reflex goes down.
Yeah.
So let me explain. Before surgery, I say, think of right now, think of last week, think of most days.
Yeah.
If you had to tell how hungry you are, between 0, which is I would not eat anything if you paid me any money, I cannot eat.
Yeah.
Or number 10, I'm very hungry, I would eat paper because I'm so hungry.
Yeah.
What is your average hunger before you have my surgery? And most patients say they're around an 8. That's I'm pretty hungry.
8.
Yeah.
Yeah, most of the time very hungry, something.
I
Some
can
people,
sit and
you say, I'm hungry now. Rutledge, stop talking. I have to have something to eat. Yeah.
It's fact.
Yeah. You feel that reflex.
Yeah.
But now here's the beautiful part. We have also surveyed 3,000 of our post-op patients from 1 to up to 10 years post-op. We asked them a question. Now, surgery's over. How hungry? Average most days, about 2.5.
Yeah.
So that what happens, in contrast to the band, where you're hungry but cannot eat, patients tell us we are less hungry. The power of that drive that says I must eat, if you think of it like a hot fire, the burner on your stove, and so many people are happy and they say, I feel better with MGB, I can enjoy 1 or 2 chapatis, I can go to the wedding,
Yeah.
I can have 2 bites, but also there is a serious side to MGB.
Yeah.
So if you say, I will pick up and drink a whole soda, then the evil MGB will come out with a stick.
Mm-hmm.
So if you eat, for example, the things that you could eat and gain weight with the band, so think of Coca-Cola,
Yeah.
candy or ice cream. Can you, as an MGB patient, have 2 sips of Coca-Cola? Of course, it's no problem. But if you say, no, I will just drink the whole thing, then the devil of MGB will come to you.
Yeah.
Okay? So this is called dumping syndrome, so I'd like to
Yeah.
describe it.
Mhm.
Yeah? The sugar will go in, it will pass through your esophagus, it will pass the stomach, because the stomach has created this new tube.
Yeah.
So it will fall directly into the small intestine. And
Yeah.
when it does, the sugar will go right in. Now your pancreas will see it, put out a bunch of insulin, but it is thinking it should be getting it from the stomach slowly, so it'll put out lots of insulin, and then your sugar in your bloodstream will drop. And you'll suddenly feel dizzy and weak and
Yeah.
tired and
Correct.
terrible. if you have a big bite of a sandwich, like if you have one chapati slowly, but let's suppose you fast, that big ball will fall into the small intestine and it will be like a sponge. It will grow like a monster inside.
Yeah.
And you will feel like someone is tearing you inside. So
Yeah.
what happens is MGB patients learn, first, they're less hungry. The burner on the stove is turned down. This is good. They may eat, but with responsibility. And if you break the rule, the MGB will punish you.
Yeah, you're right.
Now, it says, we are not unreasonable, but we are the police. The MGB is the police. You can have a drink. You can walk around your house. But if you go outside of your house drinking and start to fight, the police come.
Correct.
Okay? MGB is the police.
You're right.
One chapati is good. Broccoli is good. Sandwich is good. Chew them well. If you go against us, though,
Not
the
good.
police come. And so I have many stories, and you can talk to patients who've had MGB. They will tell you stories of the dumping syndrome. And there are two flavors, one with sugar up and down, and two with food up and down. So after MGB, we expect you'll do well, you'll be enjoying yourself, and one or two of these times you'll run into the police.
Yeah.
Once you have found the police, they are pretty rough. And you'll say, I don't think I want to see the police again. And so you will learn, I can have a little bit, I can enjoy my dinner, but as I notice this feeling, because I know the police can come.
Yeah, and I would like to say, I had a discussion with one of the patients. During that, I asked one question. Because I was having that fear in me. Now I am taking the water bottle and gulp, full water bottle I am taking. And I say, after my surgery, what will happen? I asked the patient. She said to me, no, Manohar, this is not going to be happen. First you take small sip of the water, then afterwards you can drink it. But anyhow, if you put the direct tap in your mouth, no one can save you. But there is no problem. Don't think that you will not able to drink the water
Yes.
like today you will drink, but not immediately. It will take time. You adjust your body and that will be okay.
So it's like learning to ride a bicycle. With the MGB is going to be there like a father. The father says, I want you to learn to ride the bicycle. The MGB says, I want you to learn to eat.
Yeah.
But it will say, the father does not want you to do bad things. So the father, the MGB will say, listen, this is a little Coca-Cola, okay. A little bit of sweets, okay.
Yeah.
You were at the wedding and you're having a feud, then the MGB will begin to talk to you and say, you have had 2 chapatis, stop for a while.
Yeah.
And most people find they do that very, very well. Very comfortable and very enjoyable. You've talked to the patients.
Yeah.
But do not be confused. The MGB is powerful. So if you think you will go against it, you are wrong. The reason MGB is effective is you will not go against it. MGB is there. So it will stop. Now, you can always get rid of it. You can say, I don't like this. I don't want to live like this. I want to eat all I want. I want to drink. I want to do whatever. This is fine. But the contract that we give you is we will give you a strong father, strong police force,
Yeah.
and they will be with you. So eat moderately. Eat a sandwich. Eat broccoli. Eat healthy fruit,
Yeah.
vegetables. These are great. If you say, I think I'll drink 2 Coca-Colas tonight, the father, the police, the Army, the Navy, the Air Force, they will come to you. But that is, I think, what you want. You want effective treatment. The band and the sleeve, they give you uncomfortable, and they're not effective over time. You can beat them. You can cheat. The Coca-Cola, the candy, things like that. MGB, you cannot cheat the Army. You cannot stop the police. You cannot stop the good, strong father. He will take care of you. So it's important to know that, but I think it's a good thing to me. So MGB, let's describe it. Let's go through it. Let's talk about it. The technique, what happens inside. So to understand what we do, we have to understand how your gut, how inside of you, how does eating works. So for a moment, I'll go through that.
Yeah, no problem.
Okay, so we all know, put food in our mouth, we
Yeah.
chew, and chewing helps, and we release a few of the first enzymes, and we swallow, and the esophagus does nothing. And we want to talk about the esophagus because Inside of us, there are important parts. The king of the body is the brain. The prince of the body is heart and lungs. And the gut is like, meh. They are the bottom. They are clean up and, okay? So the esophagus, his only job is to take the food from the mouth and pass through where the prince lives and get down to the belly.
Yeah.
But we want to come back to that esophagus in a minute. So esophagus, nothing. But now it's in the stomach. The stomach is great. It takes chicken, broccoli, anything you can imagine. It closes the valve on the top and the bottom, and then it turns on just like a washing machine. It pours in acid and enzymes. And can you imagine it changes it so that it can be absorbed, and your body turns it into your eyes and your brain and your muscles and our thinking.
Yes.
So this stomach is magic. Plus, it was designed by God when we used to go maybe all day or maybe even days with no food. So we could bulk up, we could eat a ton of this, put it into our stomachs, and then we are good for a day or two. So the stomach has a reservoir. It can start off small, and you sit down to eat, and you go to the wedding, and I have been with Kular, and we eat first, and then we go and have drinks, and then we eat again, and then we eat and we eat again. I'm going, we've been eating all night. And he says, yes, just 2 more pegs. And I'm going, no, but eating, yes?
Yeah.
Okay, the stomach is good for this. All right. Then the stomach has a little valve. It opens and goes to a very special little part called the duodenum. And here, enzymes come in that are very important for us to understand. The little enzymes, the bile and the pancreas, help us absorb fat. Okay, now fat is very important because of the calories.
Yes.
But interestingly, you and I are water. And if you ever made salad dressing, you know it has oil and vinegar.
Yes.
They don't mix. Or oil and water, they don't mix.
Yes.
So we cannot absorb fat. We are water. But I can explain how we can absorb fat by adding dishwashing detergent. Because you know you have greasy plates. They are all full of the grease from fried foods. Then you put in the blue dishwashing liquid, and all of a sudden the little things of fat dissolve. We are fitted inside of us with a little container of dishwashing liquid. Instead of blue, it's green, it's called bile. And it's right there at the duodenum, and that is where our bodies pull in the fat. Okay? Well, we all have a little too much. So we're going to think about this area, and then your bowel goes down to 26, 27 feet, 6 or 7 meters of that long tube, the small bowel. And all the food and calories and everything's absorbed. It goes to the colon, and the rest is thrown away. Okay? This is the gut. You understand all this? Okay? If you think of each of our purposes, the brain, the eyes, God gave each a purpose. The purpose of the gut, digest and absorb food and calories. And that miracle, the miracle of eyes and everything, the miracle of the gut is to digest and absorb, and the miracle in you and I, all of us, is working too well.
Correct.
It's a miracle, but it's working too well. I have a fat belly, we have a fat belly now. So, then comes surgery. Okay? So now we'll talk about taking this miracle that God gave us and say, can we turn it down a little bit? Its great power of absorbing fat and calories is hurting us. Because the system in the brain, the reflex that makes us eat, is too turned on. It's too hot. It's going too fast. All right, so what can we do? Well, first of all, the stomach is this big reservoir which contributes to absorption of fat and calories. Let's convert the stomach into the esophagus. Instead of being a big reservoir where we can put chicken and food and things like that, what if the stomach was now exactly like the swallowing tube, where nothing could happen, it just falls right through. So the first thing we do with MGB is we take the stomach, which is this very effective, big, swollen bag, and we convert it to a narrow tube. Not tight, Not a blockage, not like the band or the sleeve. We just make a narrow tube, and so the food, when you swallow, goes through the esophagus, as it must,
Yeah.
and it goes to the stomach, and the stomach now has been converted by Kular and Rutledge
Yeah.
to be a match
Yeah.
for the esophagus. So it goes there, boom, boom. And the idea in the past,
Yeah.
where it would sit and be in the washing machine and digest and all that stuff, is gone. It's
Yes.
still the stomach, but it just goes boom. I have no reservoir, I'm just a tube.
Yes.
We convert the reservoir, the big space of the stomach with its acid and enzymes and its good mixing power, it churns to a tube, boom, boom. So all of a sudden, something else happens, you become less hungry. So when we cut the stomach this way, you're less hungry. And now the food falls directly into the small bowel.
Yeah.
Okay? But where? Where do we send it? Remember, the beginning of the small bowel had the dishwashing detergent, had the
Yeah.
bile, which is so good at absorbing fat.
Yeah.
Let's bypass.
That part.
Yeah.
Let's bypass that. Because we know when we send fat there, we put it on our bottom. We absorb it and put it on our tummy. It goes to our chins, it goes to our arteries and causes heart attack and stroke and all these things. So we say, we've got this tube, we convert it to tube, let's not go by the duodenum, because that's where fat is perfectly designed to be digested and absorbed, and in you and I, we do not need so much. We still want fat, but just not so much. Now, the gut is long, and we can choose where to go. And what we found is, the less gut you have, or to say it differently, the more you bypass, the less fat you absorb.
Yeah.
Okay? So we say, let us try and guess what is best for you, which is, we'll go so far, but not too far.
Yeah.
We want to get away from the powerful fat absorption.
Yes.
But we want some fat, because you cannot live without fat.
Yeah.
So when we make the bypass, after doing thousands of patients, we go about 2 meters on average. Maybe in your case, we would go a little further.
Yeah.
Maybe in your case, maybe a little shorter.
Yes.
But having done thousands of patients, we know in general, people do well at 2 meters.
Yeah.
And that's the end of the surgery. So let's do it again. We take the stomach and make it into the esophagus, just a tube, get rid of the reservoir, and we bypass where the fat is absorbed.
Yeah.
Now, one more trick happens. When we bypass where the fat is absorbed, something else happens.
Yeah.
If you put fat into the intestine, and it's not digested, and it stays in the gut, it causes trouble. The fat, when it's not digested by the gallbladder bile, by the dishwashing detergent,
Yeah.
gets to the gut, and the bacteria in the gut says, oh, he did not eat it, we will eat it. And when the bacteria eat it, they cause gas and cramping and diarrhea,
Yeah.
and sometimes even the fat will be in your bowel movements.
Yeah.
So, if you eat after MGB a little bit of fat in your meal,
Yeah.
this is okay. But if you eat a little more, smelly gas, even a bowel movement, you'll see that fried food that you ate, you'll see the oil in the toilet.
Yeah.
Because the oil will not go on your belly anymore. So my patients after MGB have another way the MGB police work. The MGB police says, if you are at the wedding and you see fried foods, greasy foods, oily foods, butters and things like that, if you eat a little bite of this is okay.
Yeah.
But 3 bites, you will remember tomorrow,
Why, that was a little too much.
and then people who are sitting next to you, they'll go, oof. Because the fat has been blocked. It will not go in your tummy. You will be a beautiful, thinner person. But if you break the law of MGB, the MGB police will say, no, you may not have that much fat. A little fat is okay. So broccoli, fruit, almost no fat, you can eat it all day. But if you say, oh, have a big piece of bread with butter, then not right away, but a couple of hours, 6 hours later, you'll hear blub, 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 because that's the gas. And then maybe you have upset stomach, go to the bathroom, and you'll say, well, the butter is there.
And then better to be there on it.
That's right.
Should have left
And
the
so-
container.
And sometimes you'll be surprised, you'll say, oh, the butter is down there.
Yeah.
Because the police are very strict. If you go against the police, the law of MGB, I beg your forgiveness, but the MGB is a powerful ruler. And if you're happy with the ruler, all is well. If you don't like it, you can bring it back, but the MGB has a contract with you to help you lose weight. So it means that fat, which causes a lot of obesity, because think of this, in America, there's McDonald's. Well,
Yeah.
the French fries and a McDonald's hamburger, this is all fat.
Yeah.
Well, that fat in an MGB?
Well,
No. No, because if I let it go in, then you get obesity. But MGB says no. It says, would you like 2 French fries and a bite of the hamburger? Or the veggie burger? Or the chicken burger? Yes. This is acceptable to MGB. But if you say, I will eat all of these,
no.
because you know all the fat on the French fries is high,
Yeah.
or then I will have a big buttered sandwich, or mayonnaise on my sandwich, which is, you know,
Or then
I
we
think
put the
I'll eat
cheese.
this, then,
Yeah.
okay? So I'm trying to say the strength of MGB is good, but also if you have a strong government, you must listen.
But what is my opinion in this, doctor? When the person starts getting weight loose, he's automatically getting motivation inside.
Yes.
And I think he himself started controlling. No,
Yes.
I'm looking smart. People are appreciating when his pant size are coming smaller,
Yes.
and he looks more smart.
Yes.
So I think that there is, you can say it is not MGB. You can say a miracle gastric bypass.
Yes, absolutely. And people, you've talked to people, they're happy.
Yeah.
But there are, it's like you can be happy driving on the road,
Yeah.
but if you go off the road, you won't be happy.
Yeah.
So you have to understand the rules to
Yeah.
live with MGB. And we have some people who are not well educated. You know, they do not know all these details.
Yeah.
And they call and say, oh, I feel terrible, I have cramps, I have, you know, oil in the stools, I have all these problems. And you ask them what they're eating French fries and greasy foods and things like that. So you can be unhappy with a good road system, a good police, if you don't understand that the police will not let you drive drunk.
No, I appreciate the system you have developed. The file is there with me, 90 pages. And I have read each and every paragraph, signed and written 2 lines, again signed, yes, and written. And at the same time, I also appreciate that the person who is supporting person is also reading the same thing and signing, then attested by the notary after that. Really very, very good system, and that's make the really miracle in the life if someone go for the surgery. I don't think any other doctor giving this much big booklet or anything.
That's true. That's
Yeah,
true.
they won't give such kind of knowledge, and they won't force also to read even supporting person. And losing weight is also equally important for the supporting person, also like your spouse living in the house. what kind of
Right,
food-
because otherwise maybe the spouse brings you big fatty greasy meals
Yeah.
and he says, I'm angry, you're not eating this?
Yeah.
I'm disappointed with you. You say, no,
Yeah.
this is the law of MGB, I must follow the law.
Yeah.
So
So-
then if everyone understands it, it makes a happy family.
That's very good thing what you people are following, sir, and I appreciate. And that is only the thing to people to motivate and come out, because everyone fat, all the even I think, as per my concern, the people those who are very fat and having more obese and more, 80 to 90% are having the depression.
Yes.
Because
Yes.
everyone comes to tell them, you eat this, you don't eat this. You
Yes.
are look
Yes.
like that, you are look like
Yes.
elephant.
Yes.
You are look like
Yes.
a whale.
Yes.
So that depression will make the person to not go for surgery or go for, and then they think of different things. So here I want to point out, I went to the psychiatrist as the advice given me your procedure, and they see my mental condition, whether I am going to really opt it or not. So very good system there. Even the part you people have kept for the psychological analysis of the patient, why the psychologist, really it is a very good thing. At least I should understand about me, whether I am going to have surgery and what will be the consequences, whether my mind is ready or not. Okay, my body had a requirement for surgery, but what about the mind? So you guys have kept all the things ready, and then food and everything also right. Really hats off to your group.
Thank you.
Yeah.
Now let me tell you a trick. We are here for you because everything I've said so far is not even touching on how complex things are. So let me tell you, you said something true, but not always true. You said when you lose weight, you'll feel better. So if you're depressed, you should feel better. Okay? Let me tell you that there are many little tricks, so you should stay in touch with us so we can help.
Yeah.
We see people, okay, many times women, and the surgery, the MGB surgery, is miraculous. It makes them thinner. It gets rid of their diabetes, their high blood pressure,
Yeah.
their sleep apnea, their menstrual irregularity so they can have a child, and they call me and they are crying. They're sad. And you say, I have a video of a lady, she's, I am very sad. And I said, why? Look, you're thinner, you're healthy, you look beautiful. And they're crying, I don't know, I'm very sad, I'm very sad. So here's a trick. There are many little tricks that's so complex, I can't give you every trick. But women who are heavy have high estrogen.
Yeah.
Okay? You know the female organ,
Yeah.
estrogen. Okay?
Yeah.
When we do MGB, estrogen comes down. Okay? This is a good thing. Let me explain why first. High estrogen, higher risk of breast cancer. If you have a lifetime of high estrogen, 2 or 3 times higher breast cancer. So to drop estrogen for long term, good. But, do you know a woman who has gone through menopause?
Yeah.
Do you know anyone?
Yeah.
Do you know a woman who might have gone through the change in menopause?
They have a trouble.
Yeah. No.
Okay.
Yeah.
Did she enjoy it? Was she fun? Was it happy?
No.
Was she a little angry?
Yeah.
A little tearful?
Yeah.
Okay, why? Because the ovaries which made estrogen went down. So MGB may be making a woman healthier and better and everything. Okay? Not because MGB is bad, but because MGB is making her better. But what if I made you better by taking away your cigarettes?
Yeah.
What if I made you better by taking away your whiskey? What if I made you better by taking away your opium?
Yeah.
Okay? You're not happy, and you may not like me.
Yeah.
So, you said with MGB, as you lose weight, you should feel better and be happier. Yes, but not always. So, if you were to have the surgery, and you notice, father notices, family or friends notice that you are a little grumpy. Father, don't tell me that. Huh? We can see this sometimes.
Yeah.
I'm usually that way.
But but you can get 100 times worse if your estrogen drops.
Okay.
Because all of a sudden, the world is a bad place and you're angry at it. And me too. They don't like Rutledge anymore. You talk to many people who like Rutledge? You want to turn people to hate Rutledge? Lower their estrogen.
One lady was talking like that.
Yeah.
He's very rude sometimes. I don't know why.
Yeah.
He's written in the forms, maybe the same
Yeah.
problems.
Yeah, yeah.
I mean, yeah.
Well, not always, but sometimes, not everyone likes everyone.
Yeah.
But if we take someone who is very happy and very likable and drop their estrogen,
Yeah.
that is good for them 40 years later for breast cancer.
Yeah.
But today, they may be very angry. If you are smoking cigarettes, I take away your cigarettes, you're angry for days or weeks.
Yeah.
And if you find this, if you tell me, then we can treat it. We give you an estrogen patch for a week or 2 or a month or something.
Yeah.
So we can treat it, but it's an example of how complex the body is and how it's an advantage to have a surgeon who knows many little tricks.
Yeah.
So if everything goes perfect with you, but if you have troubles, call us because many times we know a trick. Like the man who's having trouble eating and he said, I'm having cramps, and he was eating the wrong foods.
Yeah.
Well, that's simple, but imagine that you have this surgery and you're saying, I feel sad and I'm crying, I can't go to school, this is awful, I hate everybody, I hate Rutledge, I hate Punjab, you know, I want to move to Russia, you know, I don't know, whatever. Think, oh, call Rutledge because
You told me.
maybe, but even, not just that, anything. If anything is not perfect, call because there are many little things like the estrogen that not everyone knows. So if you go to see your medical doctor about it, we have lots of effort to explain to them, you know, estrogen patch. And so you have to go through this and I have to call them. So we know lots of tricks, not because we're smart. Kular and I are not smart. Well, Kular is smart. I am not smart. But I have great knowledge because I've done this a lot.
Yeah.
I have seen many patients and my patients educate me. So I am smart now because I have had thousands of people, including family that have had my surgery, and they are sad, and that estrogen patch. And here's the interesting thing. If you're sad and grumpy and you have the estrogen patch, within hours it makes you happy. It's incredible. So it's just one example that if things post-op, any bumps or issues, call me, email me anytime, day or night, because we might know a little trick. Maybe you are slightly off the road, and we can give you a little pointer.
Yes.
But this is an example which almost no one knows about and no one thinks about. But if you go and talk to my other patients, many have gone through it. Okay. So we've been talking a while. I kind of started at the beginning. I talked about obesity, talked about the other operations, talked about the MGB and how we do it, some of the other issues. Other questions? Other questions we should talk about?
Now I think you've covered everything, but still the thing is, it is really, sometimes I have a doubt, the carving of the food is the main factor for increasing the obesity, besides the heredity and all that. We're going to talk about the heredity because that is only to saving your skin, I think. So the carving. So really our MGB is going to reduce the carving level when we separate the stomach, because some people are talking, some doctors are talking about ghrelin.
Yes, ghrelin is interesting. So let's talk a little bit about that. So first of all, we can answer your question very clearly. Okay, we have talked to many people who had MGB, and we asked them about their craving before surgery. And they said between 1 and 10, very high. I am craving food. I am hungry. And they said MGB makes it much better. It goes down to 2 out of 10. And it lasts for years, for decades. Not perfect, not everybody, but almost everyone says before surgery, craving, after surgery, mild. I'm very relaxed. I get hungry and I want to eat, but here versus here. So that MGB, we can tell you, very effective. Now, what about ghrelin? Ghrelin is one hormone, and there have been some studies showing that ghrelin does not go down with MGB. But ghrelin doesn't explain everything about hunger. Now we have found there are many other hormones, and we are only on baby threshold learning about all the hormones. And there's lots of tricks to it and all, so I don't know which hormone. But I do know that when we test our patients, unhappy, cravings, strong, powerful desire for food all the time, it bothers me, I eat too much, after surgery, much better. Now, if you go the whole day without eating MGB, you'll be hungry. But if you have some mild, small, moderate amount of food, you feel full. And then about 2 or 3 hours later, you will have the craving again, but it's mild and moderate, and instead of 8 out of 10, it's 2 out of 10.
Yeah, the same. Another doubt, what I found generally when I've gone through the all the studies, the fear. The fear means when the person is not having any surgeries, he is planning to go for surgery, but the fear is what I'm fearing, the fear of eating the food. So what happens in normal life, the person eats everything, as you explained, that what should be eaten, what should not be eaten, and what is the criteria to be chosen, and what the form of food also should be taken. Everything you have covered very nicely. So I think I got an answer, because I always having a fear in my mind. Today I am eating everything, tomorrow when after surgery I will not eat anything, shall I survive or not? What will happen to me? So I think now I have an answer. No.
Yeah, let's talk about that some more. So if you think of all the foods you can eat after MGB, you can eat anything. But can you eat a lot of anything? No. Can you eat anything? Yes. Can you eat a lot of anything? No. Can you eat a lot of anything fast? No. Can you eat anything? Yes. Can you eat a lot of anything? No. And if you break my rule, but can you have, what is your favorite food?
My favorite food is I eat most vegetables.
Okay.
Yeah, sometimes chicken.
Yeah, this is
Yeah,
good. So
chicken
that's,
curry.
yeah, you're good Punjabi. This is a normal diet for you.
Yeah, chicken curry, and you know we eat saag and vegetables and all that.
All that is fine.
Yeah, and
But if you say, I want to eat 10 pieces of chicken,
not possible.
no. Well, no, it's possible, but you'll be sad.
And another thing is what you know, the Indian culture is entirely different from all over the world in preparation of the food. I had a lot of discussion with dietitians, and in Canada, in States, and in Netherlands, where I did my PhD in biomechanics department. No one able to understand the caloric value properly of the Indian food. What happened? Indian food, what they do, they take the pulses, they take the onion, they take the garlic, they take the chilies, they take the coriander, they take the oil, they put the tomatoes, and when they, after our thing, they prepared one bowl of the vegetable, like dal or pulses.
Yes, so.
And when we go for the caloric value for that, very difficult to find out by a normal person. People can say simply, 200 calories, 50 calories, because I am a label reader. I am addict always. I always see the label,
Yes.
because I am suffering.
Yes?
So, and I should be actually read the label of the contents. So these things we are, I think, in Indian culture, people are lacking behind to get out the exact caloric value. And because there are different states in India, Punjab, very rich food, go to
The
south
Gujarat.
side,
Yeah.
you eat only rice and some one type of pulse only, and most of the time boiled food like idli and upma, where very less oil and no oil at all is there.
Right.
And there they eat only white rice, but we talk about the brown rice.
Mhm.
So only my question is that these things, I think now on MGB there is no impact of that, because when there is no fat involved, then you can eat a small amount of portions.
Eat anything you wish, but
Yeah.
here's the other thing. In all the things you read,
Yeah.
did you see a diet that I recommended anywhere?
No, I have seen some of things where, but not a
But
diet.
not, in other words,
Not
like
a
if you
diet.
think, in many other surgeries and many other doctors, they give you eat this and this and this and this. You don't have anything from MGB. MGB says that.
No, you have not recommended anything, but you have recommended the things what should be the healthier.
Right. We say
Yeah.
very simple for you.
Yeah.
Whether you want to eat North Indian, South Indian, veg, non-veg, everything is okay, with some little guidelines. Small amount,
Yeah.
slowly, chew. So whatever you get a taste for, whether it's candy or Coca-Cola or vegetarian or non-vegetarian or chicken or fried, here's what we found. We have studied my patients. Okay,
Yeah.
let me tell you. Here's what we found. Before surgery in America, my patients drank a lot of soda, sweet soda, Coca-Cola.
Yeah.
And after surgery, they don't. Okay, the reason is, before, fine, after, no. Before surgery, many servings per day of fatty foods.
Yeah.
After surgery, less. Before surgery, a few fresh fruits and vegetables. After surgery, more. Before surgery, processed meats in U.S. Processed meats.
Yeah.
After surgery, very few. In fact, what happens with the MGB, without being told, have you heard of the Mediterranean type diet? Mediterranean type diet?
No.
Basically, it's what they eat in around the Mediterranean, Spain and Italy and things like that. And basically, it's fresh fruits and vegetables, a little bit of olive oil and whole wheat things. And so your diet from all of India, any part of India, is fine.
Yeah.
It will be fine and good for you post-op. It's good for Kular's Indian patients.
Okay.
Chapatis, dal, idli, all
Yeah.
these things are good, but you will find instead of this much, you'll eat this much. That's all. And anything is acceptable. Remember, take your time. This, no. This, we
Yeah,
say,
yeah.
between the bite, put down your fork.
Yeah.
Sometimes in America we eat like this.
Yeah, driving itself eating whole breakfast now.
So this is the beauty of MGB, in contrast, I think, to some of the other surgeries. Every food is fine, whatever your taste is. Now let me tell you another little trick. I have had many people who say, my favorite food is this. And after surgery they say, I don't like it anymore.
Yeah.
So your taste, that craving, as I said,
Yeah.
goes down.
Yes, correct.
But the fear of people who say, I've had men come to me and said, I'd have your surgery, but I love to eat, and I don't want to give that up. And I will say, you will still have that love, but you can live with the love. The love is different. The love is more gentle. It does
Yeah.
not kill you.
Yeah.
You can love, but that love can kill you. So we say, you can still eat whatever you want, but you may find
Yeah.
that what you had as a craving before, you go, and then they say, you know, it's funny, I like fruits and vegetables now. And they say, what is this you've done? This is magic. And we say, it happens.
Yeah.
MGB, if you talk to the patients, before surgery, maybe they like worse foods. Now, these worse foods, they don't taste as good. They're not as enjoyable. A little bit, you say, you know, I still like a little chocolate. This is good, but I used to eat too much.
Yeah.
Have you had patients where they do eat a lot, but like the consequences are more severe than what you explained? So like you do get cramps and do like, you know, you wanna like, you feel bad, gas, everything. Has there been times when you would like actually need to go to the hospital and stuff like that?
We've had some people complain, like, I operate on a very famous wife of the person who was the president of a university in the U.S.
Mm-hmm.
So she flew to see me in the jet from the university, and the president came to see me, and we sat like this and talked, and she had the surgery, she did great, and everyone's happy with me, Rutledge, you are great, but about 2 months after surgery, the president called me and said, you must speak to my wife, and she said, I'm dying, my abdomen hurts, I'm in severe pain. I said, you must go to the ER, but I said, tell me what you ate.
Yeah.
She says, no, it's nothing I ate, I'm in terrible pain. I said, oh, that's fine, tell me what you ate. She said, well, I got up this morning. I said, did you have pain this morning when you got up? She said, no. I said, tell me what you did next. So I went to the refrigerator, and I know I ate a food. Do you know quiche?
Yeah.
Okay, quiche, you know this?
Yeah.
It's egg and
And
fat
cheese
and
and
butter. So this is high fat. So
Yeah.
she says, I ate 2 pieces, okay? Now, what happens is that falls into the bowel, and water comes in, and the gut expands. Like almost like I was putting my foot and tearing it open. And so she was feeling that, and I said, go to the ER, to the hospital, and be checked, but you should not eat quiche again like this. I said, you can have quiche, this is okay, but that's high fat.
Yeah.
And that in your stomach will punish you. Now, she never called again. She's always been happy. That's 10 years ago. She is good. But it's possible if you say, if we are talking now, if you forget everything I've told you, and if I have your permission, I'll put this on the internet, you can watch this again. But if you say, I will ignore what Rutledge told me, let me say, MGB is powerful.
Yeah.
He will come to your house, he will find you and hurt you. So do not go against. Now, if you want quiche, she can have quiche.
Maybe like half.
Not 2 pieces and not fast, not first thing in the morning though. Yeah. And most people will have 1 or 2 episodes. Like I have a patient, she's very nice, and in fact I think her video is online because she let me videotape her. She went to McDonald's because she was coming home, she was after MGB, she says, you know, she started with the bag of French fries, she'd take a bite of this and a sip of the Coca-Cola, and all of a sudden she was in her car, she said, she dropped the Coke, she put down, she said, and that was the last time she went to McDonald's. You know, she said, I don't want that again. But now if she says now every once in a while she'll have 1 or 2 French fries. She can have a little sip of Coca-Cola if she wishes. She can have a bite of a hamburger or chicken nuggets or whatever. But can you have 2 big pieces? Can you have a big Coke like this? Never again. Okay? And you will learn, and most of my patients are happy. You could say, I will wait, I want to talk to 100 of your patients, Rutledge. I want to talk to 100 of Kular's patients to see if they're happy. What they tell us, very happy. But they'll also tell you, I am happy to live in the United States, but I know if I go against the police, no, I'm not going to be happy.
No.
The MGB, you are buying a policeman who will say, I hope I'm a good, honorable, not a corrupt policeman, a good policeman who says, if you wish to have a drink of whiskey, you may. But if you want to drink 10 bottles and go out and set the place on fire, the police must stop you. And we think if you eat too much fat and quiche, it will hurt you, so we have put in place police. They will govern you. They will say, yes, you may have a sip of whiskey. Yes, you may have a little bit of chocolate. Yes, you may have a bite of quiche. But if you get up and foolishly go boom, 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 I'm sorry, I'm here from the police, and you must not do this. This is not good for you. You will be heavy like this. You do not want to be heavy like this. I'm from the police, I'm here to govern you. Honorable friend, I'm here for you. If you wish to have any food you wish, this is okay. But you may not set the place on fire.
Yeah.
We cannot have this. We are the police.
Yeah.
So, and you may say, well, Rutledge, I do not want a police. That's fine. But you cannot have this. You
Yeah.
cannot have this and eat all you want. You will have a police that will say, eat a little bit, it's okay. But,
No.
What about the impact of alcohol on your surgery and GP?
this is a good story. So I have always in the US said, no, no, no alcohol, no alcohol, okay?
Yeah.
And when I came to India,
Yeah.
I am the Rutledge. I know everything, yes? I am the teacher, Rutledge, 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 da, da, da. And Kular, a very gentle and humble man, he's always nice to me, and so, but I would say, Kular, no alcohol. He says, very polite, he says, you're wrong. And I said, no, causes ulcers, it's bad, you cannot
Yeah.
have alcohol. He says, very polite, he says, you are wrong, no. And Raman, she is very polite, she's nice. I said, no alcohol, what do you say? He says, so polite, so nice. So what Kular has taught me, and I now believe, it's taken me years to change, because you know, Americans,
Yeah.
right? I have a little of this, I'm sorry. I'm so smart, I'm Rutledge, I don't say that. But what he says is that his patients who take a little alcohol, remember that's good for the appetite, and they take a little chicken, that over the long term, they are happier. That they seem that not a lot of alcohol, and there is danger of alcoholism, of being addicted to alcohol after MGB.
Yeah.
And after any bariatric surgery, there's something about it, so you must be cautious. And so in my family, there's alcoholism, and so I fear it. You have to realize it's a danger. Kular tells me in Punjab, maybe one in every family there's an alcoholic. So it's a serious problem.
Yeah.
So we do not take it lightly, but I used to say no alcohol, and now I think Kular has taught me that actually when you eat at night, a little sip, you know, maybe, what is it called, one peg? Yeah? That actually the meal goes better, you're happier, and so I think a little alcohol may be acceptable.
Why I have asked this question, because I have gone through some of the studies where it mentioned in Europe. The Europe ladies, they are more affectionate towards eating the wine and the cheese.
Yes?
I think France.
Wine
Germany.
and cheese, we think, again, I have changed my beliefs. I used to say, and you can talk to all my patients, when they hear this video, they will jump up and they might come to my house and be angry. Because for years I pounded my fist, I said no alcohol, no alcohol, no alcohol. And now Kular has taught me. Actually, Kular has taught me many things. I think I've taught him one or two things, but he has taught me many things. And he is so honorable and so humble and a great surgeon, but I think a little alcohol is actually probably good. I don't think you have to, but I think some alcohol is good. And Raman, you think? You see it? See, you see all the patients.
Yes.
This is right.
Yes.
So a little alcohol you see in Kular's patients.
Yeah, little alcohol
Yeah.
is must. It's necessary. For
No, because only this, my curiosity is to know about the different cultures,
Yeah.
like Indian culture and the European culture, and come to the North America
Yeah.
or South America.
Yeah.
North America, they are mixed type of culture. They are like wine as plus as the beer and very less of whiskey or scotch. They don't like much. Only occasionally they. And if you go to the where I near to the Russian countries like Hungary, Czechoslovakia, Czech, and all these countries, they go for 90% alcohol because they extract from their grapes and fruits and they take that. They don't like wine and they don't like that one. And they eat cheese with that. I
Yes.
have seen with my eyes.
Yeah, yeah. I like that.
Really
That's-
definite because I had one chance to drink that called Palinka in Budapest.
Yeah.
And Palinka is 98% alcohol.
Grain alcohol.
Yeah, and I
It's
took
like
once.
absinthe.
And I experienced, I took one and it was like a burning fire gone till the end of my stomach.
Worse than whiskey?
It was some local drink they produced from the fruits, the
Yeah.
grapes and pear and all that,
Yeah,
and that's called the palinka.
yeah. Okay.
Yeah, so really I had, so that is that time I remembered when I was doing my...
Well, if I were thinking, I'd probably try a little bit milder drinks in there,
Yeah.
because the other thing we...
90%.
Yeah, that's...
No, because
well,
what
whiskey is what, 40%, I think.
Yeah, 40%.
Yeah, and
Yeah,
then-
why my intention? Because this MGV is not limited to India, or this MGV is limited to all over the world.
Right.
And different culture, people are
And
there.
I think the risk would be, if you have a very
Yeah.
potent drink, that you could drink a little too much. And then,
Yeah.
I think everyone agrees, Dr. Kular and I think agree on this, is that too much alcohol is terribly dangerous and
Yeah,
devastating.
that's okay.
But now I have changed. I said no alcohol, and he has taught me, and I agree with him now, and I agree with Raman. They are right. I was wrong. So this is hard for me to say,
Yeah.
because I think I am Rutledge. I'm never wrong.
I know it's not.
I'm going to cut this part of the tape out. So they don't do it. But I think now a little alcohol seems to make people to have a more enjoyable dinner.
Yeah.
They can have a little bit more, and they are also maybe not so quick to eat, because it kind of calms the person maybe just slightly.
Yeah.
I don't think you should take it lightly and ignore the risk of alcoholism, because you can become addicted to alcohol.
Yeah.
And but I think I have learned, at least here for India, that a little bit of alcohol goes well. So that, again, what I would say, and I'm biased, but MGB is wonderful. In other words, you do not give up anything. You do not give up anything. You can enjoy a meal. You can enjoy anything you wish. We just say, calm down. Take it slow. Take a little bit less, and you will be thin and healthy. Imagine if we protected your daughter from breast cancer. In other words, of all the things
Yeah.
in her life, maybe, because if you have extra weight, you have extra estrogen, both endometrial cancer and breast cancer go up.
Yeah.
Okay? A lifetime without that high level, and then maybe she never has to meet with a doctor who says, I must cut off the breast because there's
Yeah.
cancer, and the cancer is now in your bones, and you're going to die.
Yeah. It is.
So imagine...
Sorry.
No?
I think we have to send them for the cardiac evaluation.
Okay.
Do we-
So should we stop for a while?
Yeah. But
Yeah.